The number of confirmed coronavirus cases here in the U.S. is rising. Right now, there are a total of 606 cases across 34 states and the District of Columbia. Several universities have closed campuses or initiated online-only classes. Today, New York Governor Andrew Cuomo confirmed that the head of the Port Authority of New York and New Jersey, Rick Cotton, has tested positive for coronavirus. At the same press conference, Governor Cuomo announced a new state program to make hand sanitizers for schools and prisons in an effort to combat price gouging and shortages. New York will use prison labor to produce 100,000 gallons of hand sanitizer a week. Joining me now from Albany, New York Governor Andrew Cuomo. Governor, thank you very much for joining us. Can you just give us an update on the current status of New York?
Thanks, Katie. Well, we're basically where every other state is right now. We're doing everything we can to reduce the spread. It is inevitable, as you suggested, that the spread is going to continue. We understand that. Do everything you can to reduce the spread. And that's what we're doing. It's a little more complicated in a place like New York where you have that density. And then, at the same time, make sure people are getting the right information and they're not overreacting. A situation like this, Katie, you have the underlying issue, which is here is the coronavirus. You then have the public response to it and the fear and the anxiety and the hysteria that actually compounds the problem. And I don't believe the facts in this situation merit the level of anxiety that we're seeing. So we try to balance both.
Well, define hysteria in your terms.
Well, you know, people are very, very anxious. There's a lot of fear. This virus is not as dangerous as many of the viruses we've seen before, right? H1N1 was complicated. Ebola was a really frightening virus.
I know, but is it like buying too much toilet paper, wearing masks around? I mean, people are going to CVS and they're getting all of the hand sanitizer they can possibly get. Do you think that they're worried about getting on the subway right now? Is that hysterical as of this moment, or are those fears warranted?
Well, I think the anxiety is unduly high. If you look at the numbers, and we have experience, we have the numbers. Johns Hopkins has been tracing the 111,000 coronavirus cases from China. So we know the mortality rate. We know who's affected. And it doesn't merit this kind of anxiety. It's not great. Certainly, we don't want to lose anyone. But it doesn't merit the hysteria. And I think part of it is they're getting conflicting messages, mixed messages. And when people get anxious, it's not a rational, intelligent response. And we need everybody to work with us. But at the same time, we're doing what we need to do to reduce the spread. Testing, 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 testing. I'm pushing for more testing capacity because you want to find those people who are positive. You want to investigate down that line, isolate as many positive people as you can so you reduce the spread. Why do you want to reduce the spread? Because you want to protect the vulnerable population from this disease, which are senior citizens, people with compromised immune systems, and people with an underlying illness. Those are the people who are really at risk.
Are you prioritizing healthcare workers at senior citizens facilities, healthcare workers, or any workers at places that hold the more vulnerable population?
Yes. My fear as governor are the senior citizen congregate facilities, nursing homes, senior citizen living environments, et cetera. That's my personal fear as governor. As an individual, my family, I'm worried about my mother, who's an elderly person. Don't tell her I said that. She doesn't act that way. She doesn't believe she is. But that's my concern personally, because that is the vulnerable population. And with the nursing homes, we put out new protocols. We have a cluster in Westchester, which is a very high-density cluster. And we said in those nursing homes, no visitors, no people from the outside, because that's really the situs of the vulnerable population.
What about schools? Are you considering closing them? What will it take to close them?
We close them on a case-by-case basis. You know, you have the entire state, which is a microcosm of the country. You have higher numbers in certain areas, lower numbers in other areas. If the numbers are low, God bless. If the numbers are high, take action. As I mentioned before, we have a cluster in Westchester that has more cases than New York City. So how do you handle that hotbed, that hot spot, as they call it? Closing schools, closing gatherings, et cetera. Extraordinary efforts where you have higher density of cases.
New York Governor Andrew Cuomo. Governor, thanks so much for coming on and lending us your time. We appreciate it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.